Yeah, absolutely. So wearable devices like the Fitbit really offers a unique and objective way to track factors that are deeply connected to IBS symptom management, especially sleep. Sleep disturbances are significantly more common in people with IBS, and poor sleep can also exacerbate abdominal pain and other symptoms. Although patients often self-report sleep issues, wearables provide really a more accurate picture of sleep quality, including metrics like REM and deep sleep. And these metrics can help uncover some of the physiological patterns tied to symptom flares. This offers patients and providers more actionable insights for self-management of their IBS. Yeah, definitely. So we conducted a 4-week study, and so far we've recorded 25 IBS patients and 24 healthy controls in this ongoing study. So all of our participants wore the Fitbit device to continuously monitor for sleep patterns and daily step counts. We also collected daily abdominal pain ratings, subjective sleep quality via questionnaires, and some validated IBS symptom scales, including NIH's PROMISE questionnaires, as well as IBS symptom severity scale. And by comparing some of the objective sleep data with some of the self reported symptoms, sleep, and activity levels, we really aimed to understand how wearable derived metrics can correlate with IBS symptom severity. I think the most striking finding from our study was that a higher percentage of REM sleep was significantly associated with lower IBS symptoms. Particularly, we saw this diarrhea, abdominal pain, and bloating. There were also notable discrepancies between some of the self reported and objectively measured sleep duration. Participants tended to overestimate their sleep overall. And while StepCat did not show a direct association with symptom severity, individuals with more REM sleep did tend to take more steps. And I think this hints at a possibility of a link between restorative sleep and greater physical activity overall. And interestingly, we also saw that deep sleep showed a trend towards reduced diarrhea scores. So, this research suggests that enhancing REM sleep may be a valuable target in IBS management strategies, and wearable devices really offer a real time objective data capturing ability that both patients and clinicians can then use to monitor their sleep quality and then correlate it with symptom changes. And I think this ability to track sleep outside of a lab setting also really opens doors for personalized intervention, such as a CBT for insomnia or just like improving sleep hygiene, so that it could possibly help mitigate IBS symptoms. Moreover, some of the overestimation of sleep duration that we saw in our study and underscores the importance of using objective data, given that relying really only on patient recall might miss some kind of key insights that might be important to part of their care. I really would want to see future studies using larger and more diverse patient populations to validate these findings and potentially explore causality. It would also be really interesting to look at interventions that directly aim to increase REM sleep and assess whether they have effects on IBS symptoms. I think using longitudinal studies could also help determine if improving sleep through either behavioral or pharmacologic means can lead to sustained symptom relief. And I think integrating wearable data with microbiome profiling or even like stress biomarkers could really provide a more comprehensive picture of the gut brain axis in IBS.